Hi everyone, I'm Brittany Skyler filling in for Kib Naleen, and today is November 5th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Nearly half of New York City teens have reported depressive symptoms, and suicide remains the second leading cause of death in the youth. That's why earlier this year, Mayor Eric Adams, the New York City Department of Health and Mental Hygiene, and New York City Health and Hospitals announced Caring Transitions, a program aimed to serve youth ages 5 through 17 who are seen in the hospital after a suicide attempt or display signs of suicidal behavior. Here to tell us more is Child Psychiatrist for New York City Health and Hospitals, Dr. Nitin Toteja. Doctor, thank you so much for joining us today. So, to start off, tell me a little bit about Caring Transitions and what prompted the program.
So Caring Transition is a wraparound program that specifically addresses problem of suicide, preventing suicide in young people who present to our emergency room or hospitals. And this is a unique partnership between Department of Health and Hospital that this program has been developed. It provides youth and family services that helps engage them in treatment at the start of their presentation in the emergency room.
And so, this program was launched specifically in the Bronx and in Queens. Is there any specific reason or statistics why these were the two locations that were chosen?
So Bronx and Queens have traditionally suffered from underserved mental health systems, and they have struggled to meet the needs of the local population. So both these Bronx and Queens have seen an increase in presentation of youth with suicidal ideation in our emergency room. So this program specifically was designed to provide additional support. And the structure of this program helps engage the families into treatment. So families have struggled to feel as if mental health programs understand them and what they're going through. So the unique nature of this program helps families engage in treatment.
And this program was launched or announced earlier this year. It was announced in June. So can you tell us a little bit about what kind of ongoing treatment will the youth receive in this program?
So this program has comprises of social workers, peer counselors, not only for the family but for the youth, availability of psychiatrists to see the patient. And this program starts as soon as the child enters the emergency room. So the team gets notified that a child is presented to the emergency room with suicidal ideation or at risk for suicide or have attempted suicide. Then one of the team members goes to the hospital to be able to interview the child to see if they are able to enroll the child if the family is interested in services. And they help the child and family navigate the healthcare system in the first the 24 hours of being in the hospital. If they are admitted, they help provide support and help families process what's happening, help them understand what it means to be in the mental health care system and what's going on with their child.
Yeah. I know later on in the interview we're going to talk about how important the first 30 days are after an attempt, right? But let's talk about how crucial the first 24 hours are. And in this program in particular, what are they going to experience in the first 24 hours?
So a lot of our families, struggle to process and understand what's happening with their child. For some of them, this may be the first time the child has talked about suicide or has attempted suicide. And this is very hard for any family to process. It is hard to talk about, it is hard to understand, it can be traumatic for some families. Yeah. So the nature of this program is to help the families sort of understand and process what's happening with the child, what were the next steps, and what would happen after the child leaves the hospital, which is what you suggested we're going to talk about, which is an important time in treatment, where children are particularly vulnerable to a repeat of a suicide attempt or at risk for suicide. So the first 24 hours is a critical time to engage families when they're really trying to make sense of what's happening with their child.
Can you talk a little bit about why in particular these first 30 days are so important, and what are some, I guess we would say, prevention steps that we would take to ensure that there isn't another admission 30 days discharge?
So the scientific literature has shown that that children and adults both are at increased risk for repeated suicide attempt, 15 times more than the general population within 30 days of discharge from the hospital. This is the time when child returns back to the family. The families are making sense of what's happening. It is a time of a unique stress. And children are at risk for repeat attempts during this time. A lot of families struggle to talk about suicide to each other, and families tend to withdraw, not able to communicate about what's happened. So this program, our hope is that it sort of provides that additional tools necessary for the child and the family to be able to process and communicate to each other, to support each other during this time. So preventing a relapse of depression, of suicidal ideation, of suicide attempts.
Yeah, absolutely. And you know, Caring Transitions they provide wraparound services. So it's not just the actual patient, it's involving the patient and their families and kind of that support system that they're going to have the post 30 days, right? So tell us, what are some of the treatments or resources or tools that are provided in these wraparound services?
So the program consists of, like I mentioned, peer counselors, which support not only the youth but the family, social workers, and psychiatrists, and they provide initial assessments, safety planning, developing skills for both the family and the youth in managing these symptoms. They help provide support through groups, and the treatment happens not only at the clinic where these programs are located, which is at Lincoln, Jacoby, and North Central Bronx hospitals, but happens in their home, could happen at school. So they provide flexible services for families and youth wherever they are, wherever it's possible.
Yeah, absolutely. You know, let's talk a little bit about the impact that it's going to have on these particular communities. You mentioned the two locations that it would be at here in the Bronx, and you mentioned Bronx and Queens because, you know, statistics show that these are some of the more underserved areas in New York City overall. So what impact do you think this is going to have on the community as a whole?
So this is a pilot program, and the unique nature of this program sort of would help understand and how we can provide or sort of like change our services in the future. So this program was started at Queens at Elmhurst Hospital in June, and we have enrolled about 19 children and families to date. And we have seen some initial indication that this program is having an impact. So our hope is that as we expand this program, this would provide additional support, help families engage in traditional treatment, and the lesson learned we can apply to other programs throughout the city.
You know, I like that you mentioned that already you're seeing, not necessarily improvement, but you're seeing that the program is working. What has the feedback been like from families?
I think families have particularly reported feedback that they really like peer counseling services, which are peer counselors are individuals who have lived experience of mental illness themselves, or family members who have lived experience of caring for somebody with mental illness.
Right.
And families find these resources incredibly helpful. They're able to talk to families in a way that therapists sometimes struggle to, and they find a voice that helps families communicate to their providers. So families have found both these services and the nature of this program, the way the team is structured, quite helpful.
You know, I think that's really important because sometimes it's not as easy to talk to somebody who has not been in that situation, who hasn't been in their shoes. So I do think the peer counseling is a really crucial element, and I do, you know, see that that is something that is going to be the most receptive. And so with that, New York City Health and Hospitals serves everyone regardless of immigration status or ability to pay. So how does this open access impact the reach and effectiveness of the Caring Transitions program?
We want this program to be available to all New Yorkers. And it's important that things like insurance status, whether we take the insurance, we don't take the insurance, immigration status, all those things, barriers don't exist for children and family who come to our hospital and seek care. And this program will ensure that these families who actually traditionally have struggled to seek care get connected, because this program will make sure that these families are seeing providers and break down these barriers which have really impacted our families for mental health treatment and mental illness.
Yeah, absolutely. And, you know, going back to being in the Bronx specifically and in this community, you just mentioned the financial burden sometimes that medical bills come with, and immigration status. So tell me, what are some unique challenges you see in addressing youth suicide prevention here in the Bronx?
I think particularly in the Bronx, much like Queens in a way,
Mm-hmm.
that one of the biggest issues is access to care, access to good care,
Mm-hmm.
and also providing not only like this program serves one purpose, which is preventing suicide when it is kids are thinking about suicide or have
Mm-hmm.
attempted suicide. And this is one aspect of treatment. We also want to be able to catch children or like you get families into treatment before this happens.
Mm-hmm.
Health and Hospital is partnering with schools to be
Mm-hmm.
able to provide therapists in the school so children can engage in therapy and treatment early on.
Mm-hmm.
And this is a concerted effort by Health and Hospital and by the city to be able to engage these children. So I think Jacoby, much like other parts of Queens, parts of Brooklyn, have struggled
Mm-hmm.
to get this good quality care.
Yeah. Yeah, can you expand a little bit on your partnerships with schools in particular and how that's been beneficial so far?
So Health and Hospital has partnered with 16 schools in the
Mm-hmm.
Bronx, and we are working on hiring and also providing treatment to young people in schools. So we want to be able to engage children and families at schools where they are most at,
Mm-hmm.
where they receive education, where we can support them early on. We can provide at-risk therapy. We can
Mm-hmm.
provide therapy for children who are suffering from mental illness or have symptoms of anxiety and depression,
Mm-hmm.
and support them through the education, and also engage families. Because access to treatment, and it's hard for families to come to take time off from work, to come to clinics. I think school provides a perfect medium where this can happen. And in partnership with other school members like school counselors, existing social workers.
Yeah. And is this a K through 12 in all schools, or is this high school, middle school? What's the age range?
We have these programs open for all, depending upon the school, it's available for high school, middle school, and elementary school kids.
Okay. Awesome.
Yeah,
That's amazing. Doctor, I want to thank you again so much for sitting down with us.
thank you.
For more information, you can visit nychealthandhospitals.org. Don't go away. We'll be back with more Open right after this.